Our Community and Resident Services Department quickly adjusted when office closures and new public health guidelines meant that we could no longer provide in-person programs and services to residents and community members.
The Community and Resident Services Department connects with all of our residents on a personal level, recognizing the special challenges they face and providing them with access to services, resources that will allow them to thrive in their communities.
I am a retired psychiatric nurse. I came here from Columbus, Georgia to Freedman's Hospital School of Nursing, Howard University. I followed my mother's vision for me and entered nursing school. Lost our parents early, but they lived long enough to see my brother and I both graduating, becoming successful, and to make them proud. I thought I might return to Columbus, Georgia, but Washington, D.C. grew on me. And so I've been here over 60 years. I moved in Golden Rule Plaza end of October 2009. And with the support of the property management, I settled in quickly. There was a lot to do here. COVID came into our lives first part of the year. And according to the guidelines of CDC, Golden Rule shut down.
When the offices were closed to the public at the beginning of the pandemic, the Community and Resident Services team moved quickly to provide programming virtually. The team made calls to residents and outreach in the beginning of the quarantine to see how they were managing physically, mentally, and financially. It was important to make that connection with our residents so that we could know what they really were in need of. Virtual programming also opened the doors beyond the communities. We now have a pretty robust schedule of online programming. We offer online programming Monday to Friday on a range of topics, including healthy cooking workshops, fitness and exercise, guided meditation sessions, recovery support groups, and job readiness workshops. COVID-19 affected Mission First residents in a number of ways, from unemployment, food insecurities, financial instability, and the inability to even pay their rent. Outside of what we can kind of physically touch, a lot of residents suffered depression, loneliness, and just some things that are a bit more tangible and some things you can't really see.
Ms. Pamela Graves has made the transition very bearable. Her main goal is to keep us healthy, fit, and active. We've been sheltered in, quarantined for 6 months now. But for senior citizens, I really appreciate the fact that we've survived to our 70s, 80s, 90s. We've learned how to survive a lot of devastation, some of us, in our lives. So COVID-19 is one more challenge. Some of the old veterans, we have to remind them to distance themselves because they have survived wars and they think that a virus, that's no big thing. But we are survivors.
Residents still rely on me personally for information, resources, and just social conversation. I feel I have a responsibility to really maintain that connection with them, ensure that many of the residents and their families are doing well.
You're determined to get through this and to stay healthy and see what the other side, 2021's gotta be much better than this.